Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Legionnaires Disease. Introduction. Legionnaires disease is a type of pneumonia caused by bacteria. It is sometimes called legionellosis. You can get it from breathing in mist from water that contains the bacteria. Legionnaires disease is serious. It can be life-threatening, but most people recover with antibiotic treatment. This program explains what Legionnaires disease is and what causes it. It also talks about how the illness is diagnosed and treated. The lungs. Legionnaires disease is a type of pneumonia, which is an infection of the lungs. This section reviews the anatomy of the respiratory system. It also talks about the role of the immune system in preventing lung infections. The lungs allow us to fill our blood with oxygen. The oxygen we breathe is absorbed into our blood through tissue in the lungs. When we breathe in, the air goes through our mouth and our nose. From there it goes to the throat, also known as the pharynx. The pharynx divides into two places near the top of the neck. It divides into 1. The windpipe at the front, which goes to the lungs. It is also known as the larynx and trachea. 2. The tube at the back, which goes to the stomach. It is known as the esophagus. From the windpipe, air goes into a number of increasingly smaller tubes. These are called bronchial tubes. They are located on each side of the lungs. Small balloon-like sacs called alveoli are at the end of the bronchial tubes. The alveoli are very thin. Oxygen goes from the air into the blood through the alveoli. At the same time, carbon dioxide leaves the blood through the alveoli and goes into the lungs. It is then breathed out. The inner lining of the bronchial tubes makes a special substance called mucus. Mucus helps trap dirt from the air. It is constantly expelled from our lungs. Very small brushes called cilia are constantly pushing mucus out of the lungs. This protects the respiratory tract. Most of the time, mucus is pushed automatically. If there is too much mucus, it can be coughed out. The air we breathe can contain germs. In fact, the bacteria and viruses that can cause pneumonia are commonly found in the air we breathe. Our immune systems protect the body from infections by keeping the germs out of our lungs. Sometimes germs can get past the defenses of the respiratory system. The germs can then cause pneumonia. Legionnaires disease is a type of pneumonia. It is caused by a bacterium known as Legionella. The illness was named Legionnaires disease after a 1976 outbreak. It happened to people who were attending an American Legion convention in Philadelphia. Before the outbreak, the bacteria strain was not named. In 1977, it was identified as Legionella. Symptoms. After being exposed to the Legionella bacteria, symptoms may take a while to appear. Symptoms often begin appearing 2 to 14 days after being exposed. The first symptoms of Legionnaires disease often include a high fever, which may be 104 degrees Fahrenheit or higher, chills, headache, muscle aches or pain. After a few days, symptoms may include chest pain, cough with or without mucus or blood, exhaustion, loss of appetite, shortness of breath. Legionnaires disease may cause confusion or other mental changes. It can also cause gastrointestinal symptoms such as nausea, vomiting, and diarrhea. Legionella bacteria can spread beyond the lungs. It may infect wounds or other organs in the body, such as the heart. A milder form of Legionnaires disease may only cause flu-like symptoms. This mild form is called Pontiac fever. Pontiac fever does not cause an infection in the lungs. Symptoms often go away after 2 to 5 days. Legionnaires disease can be life-threatening. It is important to see a healthcare provider if you have any of the symptoms of this disease. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. People can get Legionnaires' disease by breathing in mist from water that contains the Legionella bacteria. The mist may come from hot tubs, showers, or air conditioning units for large buildings. You cannot get Legionnaires' disease from an infected person. The bacteria do not spread from person to person. Most outbreaks of Legionnaires' disease happen in large buildings. Large buildings often have more complex water and air conditioning systems. This allows the bacteria to grow more easily. Examples of large buildings that have been linked to outbreaks are hospitals, hotels, and nursing homes. Outbreaks of Legionnaires' disease have also been linked to cooling towers and large air conditioning systems, equipment used for physical therapy, fountains, hot tubs or whirlpools, especially on cruise ships, swimming pools. Less commonly, Legionella bacteria can also spread in other ways, including aspiration of contaminated liquids, exposure to contaminated soil. Risk factors. Most people who are exposed to Legionella bacteria do not get Legionnaires' disease. In most cases, the body's immune system can prevent an infection from happening. Some people are more likely than others to develop an infection if they are exposed to the Legionella bacteria. These people are said to have an increased risk. The risk of Legionnaires' disease increases with age. People who are 65 years of age or older are more likely to develop the disease. Having certain health problems or diseases also raises a person's risk of Legionnaires' disease. Some examples of these health problems or diseases are cancer, chronic lung diseases such as emphysema, diabetes, kidney disease. Smoking damages the lungs. This makes it easier for bacteria to enter the lungs and cause infection. People who smoke are at an increased risk of developing Legionnaires' disease. Another risk factor for Legionnaires' disease is having a weakened immune system. The immune system may be weak due to health conditions like HIV or AIDS. Certain medicines can also weaken the immune system, such as drugs used to prevent organ rejection after having a transplant. People who maintain cooling towers and air conditioning systems also have a higher risk. This is because they are more likely to be exposed to Legionella bacteria on a regular basis. Diagnosis. Legionnaires' disease and other types of pneumonia have similar symptoms. Many of these symptoms are also associated with other common infections. This can make it hard to diagnose Legionnaires' disease. A chest X-ray is often done to show if you have pneumonia and the extent of the infection, but an X-ray cannot tell the difference between Legionnaires' disease and other types of pneumonia. The quickest way to tell if you have Legionnaires' disease is with a urine test. This test checks a sample of urine for Legionella antigens. Antigens are unfamiliar substances in the body. They cause an immune system response. Other tests may be done to diagnose Legionnaires' disease. These tests can also rule out other causes of your symptoms. For example, blood tests can be used to detect Legionella bacteria. Samples of mucus or tissue from the lungs may be tested for Legionella bacteria. If a sample of tissue is used, it is removed through a lung biopsy. If you have neurological symptoms such as confusion or other mental changes, other tests may also be done. These can include a CT scan of the brain, spinal tap. Treatment. Legionnaires' disease is treated with antibiotics. Antibiotics are medicines used to treat bacterial infections. It is important to start treatment soon after the infection starts. This can prevent serious health problems caused by the infection. Pontiac fever, a mild form of Legionnaires' disease, does not require treatment. Pontiac fever will go away on its own. It does not cause any long-lasting problems. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Legionnaires' disease is a type of pneumonia caused by bacteria. You can get it from breathing in mist from water that contains the bacteria. You can also get it by breathing in contaminated liquid or touching contaminated soil, but these causes are less common. Most people exposed to Legionella bacteria do not get Legionnaires disease. You have a higher risk of infection if you are age 65 or older, have a chronic lung disease or serious health problem, have a weakened immune system, maintain cooling towers and air conditioning systems as your job, smoke. Symptoms of Legionnaires disease include fever, chills, a cough, and sometimes muscle aches and headaches. Other types of pneumonia have similar symptoms. You will probably need a chest X-ray to diagnose pneumonia. Lab tests can detect the specific bacteria that cause Legionnaires disease. Legionnaires disease is serious. It can be life-threatening, but most people recover with antibiotic treatment. Thank you for using Explain.